This is the last section of the training module learning objective of the understanding the principles of benevolence and non-malfeasance. We are going over distinguishing the difference between benevolence and non-malfeasance, and then also the application and decision making in real world scenarios, how a psychologist or a doctor may go about applying these in their field. So first, we are distinguishing the difference between benevolence and non-malfeasance. Benevolence is actively doing good. It's the act to ensure that there are more positive outcomes to a study or to an experiment or whatnot. An example would be providing vaccines to protect against a disease. And then non-malfeasance is avoiding or minimizing harm. So it's not necessarily that actively trying to benefit the participant in the study or a patient, but it's trying to avoid and mitigate the harms that could come with a procedure or with a study. An example of this would be ensuring a medical procedure does not cause unnecessary pain or side effects. And then, when applying benevolence and non malfeasance in decision making, professionals often encounter situations where benevolence and non malfeasance may conflict. For example, a medical treatment that improves the quality of life, improving the quality of life, which is beneficence, but comes with side effects and consequences, which is the non malfeasance. Another example would be introducing new policies in an organization that benefits some employees but may disrupt others. So that's more of looking at a not necessarily in a clinical trial or in a clinical setting, but in real world examples. Some questions to consider when applying benevolence and non malfeasance are: what are the potential benefits of this action? What are the potential risks or harms? And how can a psychologist or a clinician or a doctor maximize benefits while also minimizing harms? Um, there's an example, like a scenario would be a patient needs surgery that could save their life, but carries a significant risk of complications, which is the non-malfeasance, obviously. How would someone approach the decision? Well, there's a series of steps that I've designed. First, identifying the potential benefits and harms, so the beneficence and non-malfeasance, exploring different alternatives. Maybe there's something that could have even greater benefits or the same amount of benefits, but have less harm. Step three would be consider the patient's values and preferences because it's not all the doctor's decision. The patient does have some say, autonomy in which what is happening to them. And then step four would be making a decision based on informed consent and ethical principles. So, in this conclusion of understanding the principles of beneficence and non-malfeasance, they are fundamental to ethical decision making in all fields of research and in trials. By understanding and applying these principles, professionals can better navigate complex scenarios, balancing the act of doing good with the responsibility of avoiding harm. Thank you.